Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on mentors and motivators who are consistently reshaping, redefining, and rediscovering the field of medical healthcare. I would like to welcome Dr. Michael Weiner. As Chief Medical Information Officer at IBM Healthcare, Dr. Weiner has extensive experience surrounding key issues in today's evolving healthcare ecosystem.
Thank you so much for joining us, Dr. Weiner. I know it's a quick interview this morning right off the main stage where you delivered a fascinating keynote to a full house. So you have quite the interesting background. So you spent years at the Naval Academy, right?
Undergraduate at the Naval Academy, and then went to Philadelphia College of Osteopathic Medicine for my medical training.
Why did you choose the osteopathic?
I like the holistic approach of osteopathic medicine. I think, much like A4M, they had thought about that years ago, about serving the whole person. And I think, A4M, again, captured that years ago. So, again, it's delightful to be here to support.
So, did you go ahead and actually practice medicine after?
I did, yeah. I did my residency in internal medicine, internship in family medicine. Again, I really believe in the holistic approach, a whole family, whole patient. And then ultimately spent a good 20 years in the Navy, treating patients in the Navy, and Army, Navy, Air Force, and Marines.
So how did you get to IBM?
My last couple of years in the military, we were in the middle of starting to deploy. We were a couple of years ahead of the rest of the country. We were starting to deploy an electronic health record. And much like many physicians that got into IT, I just didn't love the way it was going. I didn't enjoy the electronic health record and the way it was being served up. And part of that, it was initial on, and we've all learned our lesson along the way, the electronic health records were being delivered as an IT project, much like you would deliver PowerPoint. Mm-hmm. And there's a clinical workflow that has to be supported. There's an integration in the way. I'll give you one funny story. So when we asked our IT departments to deliver computers, they went and they put a computer in every exam room. That computer just happened to be on the other side of the room. So we would all be sitting with our backs to the patient, right? So no one enjoyed that. So again, I think we needed physician involvement. And I really believe in physician involvement, physician leadership in whatever is being brought or given to the clinical community. And that ultimately is how I became the Chief Medical Information Officer for an integrated office within the DoD and the VA to, again, help make certain that whatever it is that we're going to bring forward for technology, and it's any technology, that it works well with the way clinicians think and act and behave. And really, the one thing that all clinicians want to do is deliver care.
So during your keynote, you had made the statement that Watson and IBM are about to be able to bring joy back to the practice of medicine and healthcare. So can you expound on that? Yeah,
of course. So we're very excited about this. So, if you just look at the historic triple aim of healthcare, better quality care, better cost, and better population management, we probably didn't capture the final part, and that was the physician and the provider and the clinician. So we, and this is the collective we of the medical community, now have the quadruple aim. And part of that is clinician satisfaction. And I think post Meaningful Use was the program where the government put $37 billion down so that physicians and healthcare organizations would have an electronic health record. We can talk some more about that because we all believe the same thing, and that is once we get all of this information digitized, and once we have that data available, we all believe that we're really going to change the way we deliver care and the way patients receive care. But we're not there just yet. So in that journey to get there, we delivered electronic health records in the US in particular. So we went from 17% electronic healthcare record use around 2006 to somewhere around 98% now. So it worked. The catch is nobody loves them. We're not there yet. Again, I think like any big project or IT project, there's good, there's excitement, there's the reality, and we'll get back to where we need to get to. We want providers to be able to enjoy what they do. And the reason most people went into medicine is they care for people. They want to make a difference, and they're finding themselves banging on a keyboard. So how could we use technology? My doctor has a scribe that's with him, and they write, so he and I can have a conversation, and they take, there's just not enough scribes to go around. So wouldn't it be incredible if we could automate that? So we're certainly looking to bring that level of automation so that you and I could have a discussion. If it's, if I'm a pediatrician and you have a child, the three of us could have a discussion. Watson would pull apart those conversations and then place them gently into the electronic health record, because we do want the data. The government requires certain policies and benchmarks to be fulfilled. So there are things that need to be done. I think the clinical community were all like, why is the highest paid person in this whole chain entering the data? So I think technology is going to help solve that. So we're very excited about that. And that will bring joy back to care.
And at what point in time, how many years down the road do you think that will happen?
Oh, that's a good question. I think we'll start to see the beginnings of it middle of next year, and then towards the end of the year, and then certainly the next year, I think we'll be ready to start to deliver that to the globe. And there isn't a place we go that people, and I say people, the clinical community doesn't say, hey, when's that going to be ready? Because we want it.
What do you anticipate the challenges will be?
The challenges of healthcare have always been the same, and that's we are always shocked, even in healthcare, we're even shocked at the complexity of healthcare, the complexity of the workflow, the complexity of the number of people that touch a patient, and the complexity of the data and how the data gets entered. So the complexity is, I think, what will get us. But we're ready this time around. We've been through enough cycles of this. I think we're all ready to take this on.
Now, that's on the record end.
That's the record end, yeah.
So what about
we'll say the front end.
The front end, okay. Now, what about on the diagnosing end?
Yes, so we announced a project at HIMSS, which is the big health IT conference that occurs every year. Again, this year it'll be in Vegas. About 50,000 folks, health IT professionals. We announced a project that we have up in Boston to read the electronic health record and then to be able to start to offer up clinical decision support at the point of care. So we're very excited about that. I think that'll be our first foray into clinical decision support.
Now, would this be
for diagnosis, right? So on the treatment side, we're already, I think, well down the path of taking care of tens of thousands of cancer patients.
You had mentioned in your presentation about Watson Eye. Is that what you're referring to?
Watson.
Eye.
Oh, the eyes of Watson. Yeah. Okay. No, that's a good memory. So Eyes of Watson, another project to look at images. So all the CT scans, the MRI scans, the echoes.
Would this, in fact, replace an overread, or would this be an initial read?
Yeah, no, it's a good question. And I think our first goal for this would be to do an initial read. And the example I use is EKG machines years ago started to automatically read normal sinus rhythm, right? And if it wasn't cold, hard-pressed sinus rhythm, it would put a blurb and it would get pulled out and a provider would have to read it. I think we'll probably start on that note. And part of it is, and I'll go back to, I said clinicians are burning out because they're data entry. Our radiology colleagues are burning out because, a CAT scan can produce a lot of images. That's a lot. So for the good of the patient and the good of the radiologist, why not automate some of that that's truly just normal? Like, don't spend your time on the really normal ones. Take a look at them, and if we all agree and we're trained correctly, then let's go on, and you as a talented radiologist can spend your time on those scans that have come out as not normal.
So has this been put into work yet?
Nope. It was initially announced at this year's RSNA, which is the big radiology conference, called the Eyes of Watson. And I'll just tell you, it was interesting. We put up use cases for folks that were there at RSNA, and they could come and say, "What do you think this is?" So it was a mammography. What do you think this is? And again, I know it's just a conference and people are just walking by, but the disparity of answers probably still wasn't, where we all thought it was going to be. And I think, one of our goals would be to deliver a standard of care throughout medicine. I think we'd all be better. There isn't a study that doesn't show standard of care of medicine. Cost of care is just depending on where you live and what zip code you're in and what country you're in. We probably all as a country need to settle in on what standard of care is, agree to it, and then not force it, but enable it throughout the workflow.
So of all the projects that you have your hands on, what would you say would be the most exciting that will be coming out over the next few years to change the face of healthcare?
So I love, we have a project called clinical trial matching. I just love clinical trial matching, and I'll tell you why. The data source behind it is clinicaltrials.gov. So it's sort of an agreed upon, when you get to actual clinical decision support and clinical therapeutics, you put 10 physicians in a room and, if you can get 5 answers, that's a good story. When it comes to clinical trials, there's just one gold standard, clinicaltrials.gov. So now we can offer patients a clinical trial. This is incredible. We all want our loved ones, if they should be sick or ill or have cancer, to be matched in a clinical trial. They do better, period. So that's good. We couldn't before. Anybody can go on to clinicaltrials.gov and take a look at it. It's got an interface, not the easiest thing to use. And then the data behind it is not easy to, but Watson's read it all, understands it all, and then reads the patient and says, hey, these are the trials that this patient could be matched to, which is really very exciting. And then not only does the patient do better, but medical science does better, and we get new drugs and trials get filled. The number of trials that get filled in America is abysmal, and the number of trials that do get filled that finish is abysmal, right? And I think we could all collectively change that, we would all benefit from that. And all of us, society, would benefit.
I know you have a plane to catch, but I thought I have one last question for you. Do you ever miss being hands-on and practicing medicine?
Oh, I was practicing medicine until just a few months ago when schedules, and it was unfair to the folks who were scheduling me in my clinics, because as you and I had found, it's just my travel schedule in my current role was making it very difficult to go hands-on. I certainly plan on jumping back in once things settle down. We just all have a lot of work to do together, and transforming an entire industry.
You're changing a lot of lives.
Just takes a couple hours a day, and it's delightful to be able to work with so many people, and there's so much interest in it. And we, me personally, and we as a company want to support that.
Well, thank you again.
Thank you so much.
I look forward to hearing more wonderful things coming down from
We look forward to sharing with you. Thank you.